Today we will talk about acromegaly. Now, what is acromegaly? It is hypersecretion of growth hormone after the closure of epiphysis. Now, this term is very important. Once the epiphysis has already closed and there is hypersecretion of growth hormone, the condition will be labeled as acromegaly. Now, it is different from gigantism that we had discussed earlier. We shall revise it quickly. Gigantism. Hypersecretion of growth hormone during childhood leads to gigantism. All the body parts are proportionately increased and there is rapid and excessive growth. Now that is how it can be diagnosed. Clinical diagnosis, increase in the plasma growth hormone levels and by the glucose tolerance suppression method. You can see the flow chart over here. Giving glucose orally to the patient. You can see the measurement of growth hormone and glucose levels. They are measured after every 2 hours. In normal subjects, growth hormone secretion, it is suppressed by hyperglycemia. We had seen during the actions of growth hormone. But here there will be paradoxical rise in growth hormone. This is a figure of patients suffering from gigantism. Now basically we had to talk about acromegaly here. So hypersecretion of growth hormone after the closure of epiphysis, it leads to acromegaly. So there won't be much increase in height because epiphysis is already closed, but small bones of hands, feet, membranous facial bones and soft tissues, these are primarily affected. Okay, so we can see there would be increase in the growth of viscera like liver. Condition would be labeled as hepatomegaly. Spleen, if it is enlarged, splenomegaly. Kidney enlargement called as renomegaly, and if heart is enlarged, it would be labeled as cardiomegaly. It can occur because of benign tumor of pituitary gland also. Now, what are the clinical features which can be observed in a patient suffering from acromegaly? There is a term which is called as acromegalic phase. What does it mean? It means there would be macroglossia, thick tongue. Macro, big. Okay, glossia for tongue. There would be thick, broad nose. Thickened lips would be there, and the facial features, they would be very much coarse, and skin of the person appears to be very much thick. These are the features that represent acromegalic phase. Again, I am repeating: macroglossia, thick, broad nose, thickened lips, coarse facial features, and thick skin. Second feature is prognathism. What does it mean? It means that the lower jaw of the patient, it is protruded. Why? Because of widening and elongation of mandible. Okay, so there will be more spacing between the teeth, and it would be accompanied by protrusion of jaw and brow also. Okay, that constitutes prognathism. We can see enlarged hands and feet like thick wide fingers, spade-like hands. You can see in this figure also, hands appear to be very much enlarged, thick wide fingers and spade-like hands. So by this clinical picture, you can recognize all the features of acromegaly. Acromegalic phase, what is constituted by acromegalic phase? Macroglossia, thick broad nose, thickened lips, coarse facial features, thick skin. What do you understand by prognathism? You can see over here. Okay, apart from these features, person can suffer from sweating, hypertension, and the body build shall be stout and stocky type. Okay. Now, how do we diagnose and treat? Diagnosis is same as that of gigantism, like clinical diagnosis, measuring plasma growth hormone level, X-ray, ultrasound, in which we can see the enlarged viscera. Regarding treatment part, it's very important. We can give bromocriptine. What is the mechanism of action? It is dopamine D2 receptor agonist. Now, how does it act? It suppresses the secretion of growth hormone because already it is high. We have to suppress this. Octreotide, it is an analog of somatostatin. Growth hormone receptor antagonist we can given if somatostatin analogs, they fail. And in extreme cases, like I had already told you, it can be caused by benign tumor of pituitary gland. So surgical removal of pituitary adenomas, it is advised. Thank you very much. So